Hey, it's me, Dr. Batman. This week in our foam rolling technique, we're going to talk about the hip joint. Pain in the hip joint can come from the hip itself. The hip is defined as this area right here, right where that bony protrusion is, into the groin area and deep into the buttock, deep into this general area here. That's considered the hip. Now we want to make sure that hip pain isn't coming from our lower back. Oftentimes that can happen. Make sure you get checked from your practitioner to see, is that hip pain coming from your lower back or is it coming from your hip itself? These are some techniques that we're going to show you on how to loosen up the back part of your hip along the IT band, down the outside of your leg, into the glute area. We're going to show you some nice techniques to loosen your hip up. As your hip mobility gets better, your lower back mobility gets better. All right, we're gonna focus on the hip joint. That's this guy right in here, from this area right in here where that bony protrusion is, into the big meaty part of your glutes and along into the iliotibial band that goes all the way down the side of your leg into your knee from this area by your hip. These are some areas we're gonna learn how to stretch and use the foam roller with different positions of our legs. Now, if you have any pain with any of these areas, or if you have sharp pain that persists and it causes a catch in your hip, don't do them. Have it looked at by your practitioner. This is what we're gonna do first. We're gonna first work into the meat of our glutes or in our glute maximus with the swing back vibration technique. Here we go. All right. We're gonna get it into that spot right there. We're gonna turn on the vibration nice and lightly, cross our legs into this figure 4 position like this. We can also modify it by changing our leg into this position as well. But let's start first of all in a figure 4 position. Nice deep breaths in and out. Let that kind of sink into one of those knobs. You can go rock side to side, back and forth, nice and slow. Deep breath, enjoy the day. Let it sink in. When you're working in this area, if you get any pain that shoots down your leg, get off of that area because you might be pushing on that sciatic nerve. No good. What a beautiful day. Now, once again, you can change the angle of your leg here. And you can also add or reduce the amount of weight just by sitting up off the swing back or the foam roller and then more pressure down into it. Oh, that feels so good. Next thing we're going to do, we're going to get into that iliotibial band all the way down the side of your leg this way. When we do that, what we're going to do is we're going to get into this angle here on our side and put pressure on it. All the way up where you feel that pelvic bone, or your iliac crest. I'll show you that here in a second. Sink into it, let your body drop down into the ground. You can kind of lift that leg up if you want, set it on top of the other leg, and apply pressure that way, all the way down the side of your leg. You know, you kind of hang out there if you want a little bit. Just put that pressure along the side of your leg. Work all the way down your thigh. Oh, that feels so good. Get in those spots. Let that bone zone in the middle sit along your femur so that the knobs on each side can get along the muscle or that runs along the femur itself, that long bone in your leg. As you loosen those areas up, you'll see that your lower back range of motion gets better quickly. Hold each spot for about 20 seconds. Nice deep breaths in on them. Change the amount of vibration. That brings blood into that tissue. Nice little foam rolling technique for your hip joints. There you go.